Hi, I'm Dr. Mark Jager, creator of the Spine Specialist Robotic Laser Enhanced Spinal Decompression, with another frequently asked question. Sometimes I get the question from patients, well, doc, you know what? My pain has changed since I started doing treatment. Sometimes, it's a little bit more than it was, sometimes a little bit less, sometimes it's in a different spot. All of those things are actually great things because it means that the body is responding. The body is making a change in response to the stimulus that was the treatment. So let's look at how this works. So when you go to the gym and you lift a little bit of weight, your muscles get sore, right? Because you're stressing the body out, you're changing a stimulus, giving the body something different than what it's normally used to. So what it does is the body responds in kind. It helps rebuild and strengthen the areas that have been disturbed or stimulated. So when your pain changes in response to treatment in any way, in a good way where it gets less, in a confusing way where it might be a little more, it might be somewhere different. You may experience, I've heard patients say, well, my muscle soreness is a little more, or I have numbness over here or tingling over there that I never had before. Those are all great things because when we start taking pressure off nerves, you might have seen in one of my other videos that you put pressure on a nerve. And when it put pressure on a nerve, it stops conducting. So it's like a wire that has a short circuit. It stops conducting information. When you start pulling the pressure off of it, you're going to start getting more information. So kind of like if your leg, you're sitting on it and it falls asleep, you stand up and it starts to tingle like crazy. That's because the nerve is starting to transmit information again. So the worst case scenario, the worst thing you can possibly do is if the pain gets a little bit more and you stop doing treatment, your body's starting to respond. So if you stop doing what's making it respond, it's going to go right back to the way it was. So the best advice I can give you is the body is going to change. There are things that are going to change that you feel. There are things functionally that are going to change. Maybe the way you walk, maybe the amount of endurance you have, maybe the areas that feel sore now are going to be different, and areas that aren't sore now might get a little bit sore because we're taking pressure off of numb areas or areas that used to be numb. So the best thing you can do is keep doing what you're doing, communicate all changes to your practitioner, because there are also things that we can change throughout the care to actually make sure that you keep moving forward. So for example, sometimes patients will get a little sore after one of the treatments. Well, what we do is we up the laser a little bit, or potentially do a little bit of muscle work or shock wave or something to try to help release the inflammation. When the pain goes up, it's because you have less pressure on the nerve that you had before, and sometimes you have more circulation of the inflammation that was trapped in those areas that we released. So if we stretch it out, we release areas of numbness, pain, and inflammation. They're going to travel around. So we need to make sure we get them completely out of there. So, main thing, keep doing what you're doing. Do not quit. Quitting is the worst thing you can do. Make sure that your practitioner knows what changes that you have experienced, and then we can make adjustments accordingly to make sure that you keep healing. Thank you very much for watching. I hope this has answered that frequently asked question for you, and I look very forward to seeing you get better. Thanks so much for watching.